you are now live.
Happy New Year's, everyone, 2023. We're back with some questions and answers for you. We had a great 2022. Hope you guys did as well. Tremendous work. We've made a lot of progress, invented some new techniques, and we're back starting 2023 with our questions and answer session.
Yes, all right. So starting off with Christy, she would like to know how much fat can be lipoed off of somebody safely.
Yeah, there's a couple different components to that question. So safely depends on what you do after the surgery, right? So for example, let's say someone gets liposuction and then they get sent home and then they're not provided with the appropriate instructions of what to do and what not to do. And you can get dehydrated fairly easily, not focusing on your recovery. The flip side of that is you can stay overnight in like a overnight center and get hydrated, and then so that amount varies. It also varies on how tall you are, right? Tall, a 6 foot tall person could potentially have more fat taken out than a shorter person. So it's an individual amount. 5 liters is the basic book answer for outpatient surgery. We routinely go beyond that, and people do just fine. And of course, you can go quite a bit beyond that with some steps in place. So you can do 8, 9, 10 liters pretty consistently in healthy individuals with the proper instructions and perioperative kind of guidance.
Do you recommend using like hydrating IVs before or after liposuction?
Well, you're definitely going to get hydrated during surgery. Before, you don't really need hydrating IVs because if you just drink the water a lot, like if you stay hydrated prior to surgery by just drinking water, it's better than IV hydration, most likely, because it's a natural way to get the fluids. During surgery, we hydrate you, and then after surgery, you can either hydrate yourself by drinking water, and if you're kind of struggling to keep up, you can always have either a mobile IV therapy company come by and give you an IV, or you can stay in an overnight kind of facility and can give you some fluids there as well. But most people are able to do just fine hydrating by just proper hydration normally.
Bianna would like to know, what is the difference between liposuction and a tummy tuck?
Good question. Liposuction is just removing fat through suctioning. So no skin removal, no muscle repair. If there are any hernias, no hernia repair. A tummy tuck is skin removal, and of course, in our office, we include liposuction with our tummy tucks. We also include the muscle repair, the pubic lift, the hernia repairs if they're involved there, as long as they're not like giant hernias. If they are, we can still do it, then we just have to designate more time in the operating room, and then obviously the quote changes a little bit for that. But basically, liposuction is just fat removal by itself. Tummy tuck is skin removal, and at least in our office, it's also the liposuction, it's also the muscle repair.
Right. Pierre Beck would like to know, what is the recovery like for an arm lift?
It varies because some people need quite a bit of liposuction with their arm lifts, and then that person experiences the recovery a little bit different than if you're just getting the skin removal, right? So somebody that has almost complete weight loss and you're just doing some skin removal, the recovery is pretty quick. Somebody that has very large arms and loose skin, you have to liposuction and then remove skin, so the recovery just feels a little bit longer. You're a little bit more swollen, a little bit more sore. But in general, the first 2 weeks, you just want to take it easy, don't do too much. No working out for about 6 to 8 weeks for either types of arm lift procedures. So in general, a week to 2 weeks off of work, and then about 6 weeks for working out.
Chica Life would like to know, does muscle tightening differentiate on higher BMI patients?
Not necessarily. It all depends on whether you can be a high BMI patient, but your muscle could be perfectly fine. So a lot of that fat could be on top of the muscle. In that case, there's no muscle repair needed. If for some reason the muscles are separated, then it's important to look to see if they can be tightened. For most people, they can, but for some people, they can't because they also have a lot of intra-abdominal fat. So that's the one rate limiting step, at least in my hands, is taking care of that intra-abdominal fat. That's fat underneath the muscle on your organs. So if you have a lot of that, then we might not be able to tighten the muscles as much as we wanted to.
Is there an anesthesia limit for higher BMI patients, like for how long they can be under?
Nope. The BMI is just 2 numbers. It's height and weight. And so what it does is it just communicates simply a number. So it's high, basically it's body mass index. And that number, whether it's 30, 35, 40, 45, it just takes into account height and weight. It doesn't tell us about your health. And the length of the surgery and the safety of it is dependent on the health of your overall health. A lot of times it's just lungs and heart. And then, of course, the kind of surgery that we're doing and how much maybe impact we're having on your body. The BMI by itself doesn't really communicate much to us, so there's no anesthesia limit for BMI.
Bethany H. would like to know, can you eat and talk after getting a genioplasty or chin lipo?
Yeah, both. You can eat and talk with both because obviously the jaw moves, the vocal cords move, your tongue moves, everything's fine. For genioplasty, when you make the incision inside the mouth, I recommend doing a little bit of a liquid diet for the first day, maybe a little puree diet for a day or two after that, just to give that a chance to heal so there's no big chunks of actual solid food. For liposuction underneath the chin, it doesn't make any difference because it's all just it's just underneath the skin here. For liposuction of the chin, you do have to wear a compression garment, so you might feel some restriction, but you can eat and talk just fine.
Right. Olivia would like to know, what is the difference between a tummy tuck and a panelectomy?
A panniculectomy involves just the tissue removal that overhangs your pubic area, right? So it's that overhang. That just gets removed as a wedge. There's no dissection of the tissues. Oftentimes there's no repositioning of the belly button, and there technically isn't any liposuction. Now you can add liposuction to a panniculectomy. You don't really get access to the muscles, at least to all of them, and so muscle repair is not really part of a panniculectomy either. So think of it this way: panniculectomy, just skin and fat removal of the overhang. Tummy tuck is skin and fat removal of the overhang, but also some tissue above that. Belly button repositioning, liposuction, muscle repair.
Jessica would like to know, do you require weight loss before getting a tummy tuck?
I don't. We don't have a BMI or a weight restriction. Again, the goal is twofold, right? We want to get a great result, and we want to do so safely. And as long as we accomplish those two, then we can go ahead. And so obviously the safety is, a lot of it is just your overall safety. It's not your BMI, just heart, lungs, diabetes, any kind of issues like that. And then, of course, a good result is, it all depends on what that tissue is, right? So it could be someone that has a lot of their tissue intra-abdominally, and very little underneath their skin. They may not be a great candidate for any kind of surgery. They really need to deflate their intra-abdominal fat. But for the most part, it's fine.
Right. Jackson would like to know, what types of hernia repairs do you do?
Well, lots of umbilical, also known as belly button hernias, ventral hernias, which is in the midline, quite a few incisional hernias, which is basically hernias in your abdominal wall where there has been prior surgery, and therefore it resulted in a weakness there, and inguinal hernias. Those are the most common. We also do some femoral hernias as well.
Danielle would like to know, for a plus-size tummy tuck, what is the overall recovery time to resume all activity?
Well, all activity, if you're saying, well, I want to do all physical exercise activity, all core exercise, all that stuff, I'd probably say good 4 months, because at 6 weeks you can start exercising, but you want to do some small exercises first. And it takes a while to really feel comfortable in terms of discomfort, but also in just, not overdoing it. To really do things like core exercises, bar hangs, pull downs, Roman leg raises, things of that nature. Those takes about 3 or 4 months.
Victoria would like to know, do you use drains with your tummy tucks, or do you do drainless tummy tucks?
We can do both, but most of my patients, once I communicate the pros and cons of either, most of them select the drain. I like using a drain, and it's amazing, even if you do all the things that are part of a drainless tummy tuck, which is putting all the quilting sutures in place, the drain still puts out quite a bit of fluid. And that fluid would otherwise be in there if there was no drain, and it would form a little bit of scar tissue. So I like a drain. The reality is that right after surgery for the first week or so, you're not really doing anything anyways. So the drain's not really encumbering your activity. You're not going to a black tie affair or even work or things of that nature. So I like using a drain. I also use drains with all my liposuctions for the most part. Small amounts of liposuction we don't, but large amounts of liposuction, I like to put a drain in there as well.
How long are patients usually supposed to keep their drains in for?
Yeah, we always look at what the body's telling us, right? So the body's putting out a certain amount of fluid, and we want to wait until that fluid is at a certain level per day, and that's when we take the drain out. And that's very important because everyone's healing is a little bit different, and the surgeries are totally custom. So, some person might have a lot more lipo, maybe their recovery ability is a little less, so that the drain stays in there a little bit longer.
Myra would like to know, is it possible to do a tummy tuck, bra line back lift, and BBL all at once?
It is possible. We do that all the time. We do also tummy tuck, bra line back lift, breast lift very frequently as well. Absolutely. If you're otherwise healthy, there's no contraindication to doing that surgery. We can certainly do it all at the same time. Depending on the person, it might take anywhere from 6-7 hours to maybe 8 hours to do that, which is fine. We do long surgeries all the time. So if everything else checks out in terms of your overall health, then we can certainly do that.
Michelle T would like to know, how come you don't have a BMI limit but other surgeons do?
Well, I don't know why the other surgeons do. I suspect they're working on the data that has been published a while back. I don't have a BMI restriction because, like we talked about in earlier questions, if we can do it safely and get a great result, then I want to do those kind of cases, including plus size tummy tucks. And the key is, we've been at it for 15 years. So, when we started, we did slightly above the BMI that most surgeons don't do. And then we just kept on doing higher and higher BMI. And as we were doing that, we kept on running into different requirements for how to do the surgery, how to instruct patients for the recovery. And so we kept on adapting, tweaking how we do the surgery, how we do the post-recovery period. And that's how we're able to do it now. If there's a surgeon that wants to do that, it's challenging for them to go from never doing a high BMI patient to doing a high BMI patient right off the bat. Because if you do the same things for a low BMI patient as a high BMI patient, then you do run into the complications. But we've been very fortunate. We've had the benefit of really slowly advancing how we do things over the last 15 years.
Team Sean would like to know, how do you decide whether to do a vertical incision with a plus size tummy tuck?
Well, the vertical incision is a choice that the patient can choose or not choose depending on whether they need it. So the vertical incision is always done at the end of the regular tummy tuck, so where we have the horizontal incision first. And at the end of it, we see how much skin wants to be kind of grouped up in the center. If it's quite a bit and the patient doesn't mind the vertical, then I end up doing it. However, if there's no tissue that can be excised, then we end up not doing it. And of course, if the patient says, hey, don't do it no matter what, then that's fine. We always try to narrow the waist as much as possible. And sometimes when you narrow it a lot of skin kind of bunches up in the center. That's where the vertical comes in.
Rachel Williams would like to know, can you get a tummy tuck if you have high blood pressure, but it is under control?
Yes, yeah. Any medical problem that's under control, it isn't really a medical problem at that point, right? So hypertension, but you're on medication, so now your blood pressure is normal. That's not a problem. That means your physiology is within normal limits, and we should be fine.
Noah would like to know, do I need to stop taking medications for surgery? I currently take ADHD medication and weight loss medicine.
Not necessarily. I mean, we'll go through that if we do a consult, and then we can go through those medications. We can, and also at pre-op. Obviously, you'll have to stop taking them the night before surgery, the morning of surgery, and so you'll skip that morning's dose, and maybe a day or two afterwards we can figure out how important those medications are with you. The key is, any medications that you're taking that aren't necessarily needed for the first day or two afterwards, we usually want you to hold off because, you're taking other kind of medications at the same time. We want you to get nauseous. The key is really getting you focused and staying focused on hydration.
The Glam Life would like to know, do you ever turn away any patients with a high BMI?
Not because of BMI. If we can't meet one of those two requirements, right? Great result and safety, right? So if we can't do it because of safety for one reason or another, then obviously we won't do it. And if we can't get a great result, then that's going to be communicated, and obviously we most likely won't do it because there's no point going through surgery and spending money if it's not going to be a significant aesthetic improvement.
Keisha would like to know, do you provide garments and compressions for your patients, or are we supposed to bring our own?
We provide those.
Grace would like to know, can you make the definition of abs more noticeable?
I think you're referencing to etching, and that depends on two things. One is what the amount of tissue is between the muscle and the skin. Because if there's quite a bit of volume there and you're doing basically like definition liposuction to create the etching, like etching, abdominal etching, it can look a little weird, right? And so you have these like six packs, but then it just doesn't make a lot of sense with the rest of the body. So I'm not a big fan of doing that in those circumstances. The other component that I usually like to discuss with patients is, if we can augment that, that's great. But you have to remember that when you're etching it, you're etching these static lines in a tissue that will continue to age. That's important to know because then those ideal definitions, where they look great for that first year or even two, after a while they'll not be in exactly the right place, right? Because the skin will go down a couple of millimeters, there's laxity. And then it's kind of hard to correct irregularities of the skin down the road.
Kelly's Cakes would like to know, what are some of the main risks with the plus size tummy tuck?
Well, it's the same risks as the regular tummy tuck, right? So it's, blood clotting, DVT, PE, wound dehiscence or wound necrosis, the standard anesthesia-related complications. So those are all the same. Obviously, a bigger patient, if you do things the same as for a regular kind of normal BMI patient, you're going to run into a lot of problems. But if you do it modified, if you kind of do what we've learned over the last 15 years, the complication rate is the same. I can't remember the last time we had a wound necrosis in our office. I mean, it must have been 2-3 years now, maybe even longer than that. We've gotten 5 blood clots over the last 15 years, and they've all been at like 4 to 6 weeks out. So it just goes to show that it wasn't early associated with surgery, just down the road when the patients got a little dehydrated. We restarted their blood thinners, they did great, nothing bad happened there. So the complication rate for plus size tummy tuck and regular tummy tuck can be the same, good and bad, depending on how you manage it. But we've been really fortunate. Yeah.
How do you prevent blood clotting?
Well, there's a couple different things, and you have to look at each patient. Some patients have a blood clotting disorder, and you have to try to identify that. And that's through hematology. But without that history, medical history knowledge, then you have to look at the risk factors, right? So risk factors may include being on things such as birth control pills. You have to look at things like mobility. You have to look at hydration before, during, and after surgery. Positioning during surgery, mobility afterwards. And then, of course, we also add a blood thinner on top of that.
Amelia would like to know, what is the highest BMI you've ever worked on?
I know we've done a 54, BMI 54. We might have done some higher BMIs than that. I can't, off the top of my head, I don't know if we've done a 60 before, but I know we've gotten pretty darn close. We might have done a 60 before. But definitely mid-50s.
Right. Truth Be Trinity would like to know, are you actually not able to sit down with a BBL, or is that just a myth?
I think it's just a myth. There's a lot of plastic surgeons that don't want their patients to sit down, so therefore they never do a tummy tuck and a BBL together. But I have no reason to think that sitting down on your buttock area or laying down on your buttock area will make any impact. Obviously, you're getting up to go to the bathroom consistently, and you're going to be laying or sitting on something soft. So you're taking the pressure off of it. So I've never had a problem with that. I've never required my patients to not sit or lay on their buttock area. I just say, obviously, use common sense. You don't be sitting or laying down on a very firm surface for long periods of time. So at least from my standpoint, I don't restrict our patients from doing so.
Danae would like to know, are you the only surgeon that operates there?
I'm the only surgeon that operates in my office. So I don't have any fellows, I don't have any residents, I don't have any associates. So I do the whole case from start to finish.
Ms. Perez would like to know, have you ever done procedures on patients with lupus, and is the recovery time any different?
We have. I did not notice any difference. I think it also depends on the medications too, because if you're on high dose steroids, then that might impact the healing. But if you're otherwise on just normal medications, you should heal just fine. I've not seen any problems with lupus and healing.
Right. Vivian would like to know, how much time should we plan out for a trip to come to AZ for surgery?
Well, if you're getting a tummy tuck or any kind of body contouring surgery, I would recommend staying here for a minimum of 2 weeks. That gives you a chance to get some of your energy back, gives you and I a chance to kind of see each other a handful of times before you head back to home.
All right, and then following that, how long you kind of keep up with post-op patients when they leave?
Yeah, we do either in-person follow-ups if you're here or virtual follow-ups if you're elsewhere. weekly for usually at least 6 weeks after surgery, and then space it out as needed beyond that, usually every 2 weeks or a month after that.
Hassan would like to know, have you ever worked on any out-of-country patients?
Yeah, about almost 40, I think 40% or something like that of our patients are out of state or out of the country. And so we've done, off the top of my head, England, Abu Dhabi, New Zealand, Australia, Israel, a couple countries in Europe, South America. Yeah, so we've done a little bit of everything.
Vicky would like to know, do you have a recovery home or do you have any recommendations for one?
Yeah, we do have a recovery overnight area for that's right in the same building, and so that's what we have our patients utilize, especially after plus size tummy tucks.
Des T would like to know, does every tummy tuck require a new belly button?
Well, so imagine your belly button like a straw, where the bottom of the straw is your abdominal muscle, so it's kind of like a cul-de-sac. So when we do a tummy tuck, we make an incision around the circular portion of that straw where it connects with your abdominal skin. So it's like a tube at that point. So the skin gets pulled down and then that tube gets brought back out. So it's your belly button but through fresh skin, and that's how we shape it as well.
Carrie would like to know, is there a surgery that can change the shape of my butt without changing the size?
Well, it all depends on what your buttock area needs, right? So if you have excess fat, you can liposuction it, right? So therefore, you can shape it by just contouring like you shape anything else. And if your buttock area is overall a certain size, but it's in different proportions, then you can actually do a combination of reducing it where there's too much fat and adding fat to where there's not sufficiently. So the overall size stays the same, but the shape is different.
Madeline would like to know, how long after a gastric sleeve can you get a tummy tuck?
You'd want to do it when you are not in that peak weight change, right? So, if you plot your weight change after a gastric sleeve, you're going to have a lot of weight loss and it's going to plateau. You want to kind of do it in the plateau section, especially if you're losing a lot of weight in the tummy area, because obviously if we tighten the tummy area and then you end up losing more, then you might have a slightly less tight of a result. Usually it's not that big of a deal, so it doesn't make that much of a difference. However, if you're losing a substantial amount of weight and you're right at that peak, then you'd want to wait until you at least start plateauing a little bit.
Karma M would like to know, when is the best time of the year to get surgery?
I don't think there is a right or wrong time. I think it depends a little bit on where you live and how you like to travel. So for example, let's say you live somewhere where it's really cold and you try not to be there while it's cold. Well, our winters are pretty mild, so that might be a good time. The flip side of that is some people in Arizona are the opposite. Like, hey, during the wintertime, we have nice weather, I want to be active and doing all that stuff. So I have surgery in the summertime when it's hot and I'll just stay indoors. Sometimes that happens, so it doesn't make any difference.
No. And then Susan M would like to know, can you do a fat transfer to your hands and neck?
You can, yeah. It's interesting, I've never had anyone ask me for fat transfer to the neck, but you can certainly do so. The hands, it's very common because as we age, we lose volume in our hands, so our tendons and the veins become a little bit more noticeable. But you can do fat transfer anywhere that fat tends to live. So if for some reason somebody's done liposuction of the neck and they've removed too much fat, you can. If for some reason your neck is kind of veiny and you're trying to get a little bit more volume there, you can certainly do fat transfer to the neck as well.
Frankie would like to know, do you have a most common procedure and do you have a favorite procedure?
Well, it's changed throughout my career. So, maybe 4 years ago, for example, we were doing a lot of rhinoplasties, which is great. Now we're doing just a lot of plus size abdominoplasties and other body contouring procedures. Every year we try to push our abilities and our results more, and I think we've really had an exponential improvement in the type of results that we can get. So I think now, even more than before, I think people are seeing that and they're really appreciating what they can achieve with a plus size tummy tuck.
Is liposuction done differently if it is being used in a transfer?
Yeah, it depends on how you do it originally, right? So ideally, yes. Ideally, you would turn down the suction a little bit so it's not suctioning so aggressively. You would soften the fat first, and then of course when you suction it, you want to do it through a slightly larger cannula than a slightly smaller cannula, and it has to go into a some sterile inline container, right? Because the regular containers are non-sterile. So those are the main things, and then of course you want to wash the fat, and then when you inject it, you want to inject it with kind of the same care of pressure and sensitivity.
Julieta would like to know what procedures can be done on the legs and what is the approximate recovery time?
Well, it all depends on what you need. So liposuction removes fat. If for some reason you need fat, then you can fat transfer the legs. If there's loose skin, you'll need to do a skin tightening procedure. So on the thigh, there's a thigh lift. You can theoretically do a calf lift as well, not as common. So all sorts of different things, but it comes down to volume, too much, too little, and then laxity. Is it good skin tone versus poor skin tone?
Do you recommend doing multiple procedures at once, or do you break them up into different surgeries?
It makes no difference. Obviously, some patients, from a health standpoint and from the logistics standpoint, it might be beneficial to break them up. So, for example, someone with a BMI of, let's say, 50, and their tummy is very big, but they also want to do a back procedure. It's going to be really challenging to do that at the same time because they have to lay on their tummy first, do the back, and then we flip them over. So usually, most people can do combination surgery and do just fine. Every once in a while, I'll recommend that they stage it for logistics and safety issues.
Tis Rig would like to know how long before you can fly long distance Europe after an extended tummy tuck and BBL?
Well, we have patients from Europe, so obviously they stay here for 2 weeks and then go fly back to Europe afterwards. So theoretically, 2 weeks you can fly back to Europe if you need to get home. If you don't, because you're local, I would not rush that. I would just stay where you are. Don't take any unnecessary risks. Hydrate, recover, get your energy back, do your follow-ups, and then down the road, 2-3 months down the road, you can travel and do things of that nature.
Angie QT would like to know, are you a candidate for tummy tuck liposuction if you have and then I might be saying this wrong, hydrantitis suppurative? HS.
Hidradenitis suppurativa. Yeah, it's totally fine. Yep, there's no problems. Unless you have an active wound right where the incision is going to be. That might be a little bit questionable, but it's not a problem.
The MUA would like to know what areas of liposuction are included with your plus size tummy tucks.
The abdomen and the sides of the abdomen and the pubic area.
Annette would like to know, how does someone get rid of skin indentations in their buttock area?
Well, that's most likely cellulite, and we don't have a magic bullet for cellulite, meaning there's no good way to fix it. Sometimes you can add a little bit of fat around it, you can release some of the ligaments and make it a little better. If you have a couple of indentations, that's better, but if you have a lot, it's challenging because the more ligaments that you release, the more the skin kind of gets unreleased, right? And so that leads to laxity, and that might create cellulite in other different areas. It's challenging. So it's a case-by-case scenario, but cellulite by itself, we don't have a great one-size-fits-all solution.
Pretty Needy would like to know, do you do consultations for out-of-state patients? I live in New York.
Yeah, absolutely. We do virtual consults and in-person consults, and you're welcome to start off with either. Most people will start off with a virtual consult, even if they're local, because it's just easier. And that allows us to generate a quote, and that gives you an idea whether it's something that you want to pursue. So especially if you're out of state or out of the country, then a virtual consult is preferential.
Tina R would like to know, how much time should I expect to take off work for a plus-size tummy tuck and bra line back lift?
Minimum of 2 weeks, absolutely minimum of 2 weeks. 3 and 4 weeks would be better if you can. But 2 weeks is a minimum. Your body just using so much energy that you'll go to work and you'll be so exhausted 2, 3, 4 hours into your shift or whatever kind of work you do. You'll just be punished. So it's just better. Minimum 2 weeks, ideally 4.
Lillian would like to know, do you only operate in Arizona?
I only operate in Arizona, yes.
And then finishing up, how far out are our consultations and how can you go about setting one up with you?
We try to keep our consultations pretty tighty on the schedule, so I think maybe 2-3 weeks out for consults. We just try to do more consults, more virtual consults if there's a lot of backlog. Surgery might be, or usually 3 months out, plus or minus. Sometimes a month more, sometimes a month less, but 3 months is a kind of good time frame. You can get a hold of us in so many different ways. Instagram, on our website, there's a consultation button at the top, Dr.Repta.com. And of course our phone number, 855-377-3782. You can always just give us a call. So lots of different ways to do that.
All right, well, thank you very much,
Thanks,
Dr. Repta.
guys.